start out with a quote from Richard Levine, who is now second in charge of the health of the United States. And he says, I like to quote that sage Yoda from Star Wars. You know, fear is the path that leads to the dark side. Fear leads to anger. Anger leads to hate. Hate leads to suffering. I think that people fear what they don't understand. And the quote says, she said, but we know this is a he. And this is just infuriating. First of all, it's suggesting that anybody who doesn't agree with developmentally delaying children with puberty blockers is on the dark side, which is incredibly offensive. It's using it's using Star Wars to defend the use of hormones and puberty blockers on kids, vulnerable children who need mental health services. And again, this is the second in charge of our health services, and he's relying on a quote from Yoda to justify the use of puberty blockers.
Well, the thing is that we know exactly the diagnosis for Richard Levine, right? We don't, it's actually written already. I'm sure he's received a diagnosis for autogynophilia, and children don't have autogynophilia. So his experience as an autogynophilic heterosexual man is really not comparing to a child's discomfort in their gender. He has clearly has a sexual a sexual obsession. Yeah. And people say, well, who cares? It's harmless. And I'm really tired of people saying that to me because, autogynophilia is actually incredibly serious, and it does affect women because these men become so completely obsessed with being us that they think they're entitled to absolutely everything. A great example is, of course, the Michigan Women's Festival, where these men were so obsessed with female biology, and they ended up, I think that, what was it, that a man ended up killing 2 women and their child. So this is like, I really take massive issue with him trying to invoke his fake history of child gender dysphoria.
Yeah, and this is really concerning to me because he's trying to compare autogynophilia with these children's experiences of discomfort in their body. And what's really infuriating to me is his background is in eating disorders, and he should know better because these children's experiences with discomfort with their bodies is very similar to children who have eating disorders. And when kids have eating disorders, we don't affirm them and encourage them to have eating disorders. We get them help. But in this case, these children who have these troubles, we're actually encouraging them to believe that they're inherently flawed and that they should seek treatment that is actually not proven to be beneficial, that has incredible harms, and that has going to result in long-term side effects. In fact, we just had evidence, a result from an ongoing study that was actually done by those who are in favor of using puberty blockers that showed evidence for puberty blockers is very low, that there's no benefit for using puberty blockers, not to mention the fact that kids who are on puberty blockers then have to get growth hormones because the puberty blockers stunt their growth. So these kids are just getting their bodies are getting bombarded with medications, and they're not being treated for the underlying issues, which is their body dissociation from their body and their hatred for their body. No child should be told that their hatred for their body is reasonable and legitimate.
Well, we've talked about this before. We have never seen children coming out in these droves, in these huge numbers, saying, I want to be the opposite sex. When I grew up, I remember one kid, my friend's little sister, wanted to be a boy. It was an ongoing thing. I actually don't know the resolution of that. That's the one time I ever heard of that in my entire upbringing of that happening. It did not happen. Why it's happening now is because of activism. It's activism. These autogynophilic men, if they can convince society that, oh, this is an inborn thing, they're born this way, then it justifies their existence. It justifies their desires for everything they want. And the medical industry is happy to come alongside because, oh, you mean got more people to medicate. Oh, and when we get kids on puberty blockers and cross-sex hormones, they're medicated for the rest of their lives.
Yeah.
Of course, the pharmaceutical companies are all over this. It's ludicrous. It's horrible.
And I just want to address
And-
something that I keep hearing over and over again, and that is that legislators should not dictate how doctors treat their patients, because doctors do not tell legislators how to do their jobs. I hear this over and over and over again. So I just wanted to go through some of the cases in which we have had to step in and intervene with doctors who have been doing horrible things to patients. Because guess what? Doctors don't always do what's in the best interest of patients. And I'm just going to bring up a few examples. One of them is just a horrifying example. This is a man who his name is Inges Semmelweis, and he actually discovered that women were dying of childbirth at an alarming rate because doctors were doing postmortems on women and then going straight in and doing vaginal exams on women who had just given birth. And the rate of these women dying was crazy high. And this man noticed that women who gave birth at home were not dying anywhere near at the rate of the women who were giving birth at hospitals. He discovered that if the men wash their hands, if these doctors wash their hands before examining the women after birth, that the rate of death went way down. Well, guess what happened to him? These male doctors didn't like being told what to do, and they institutionalized him. He died in an institution. This is what happens. Like, doctors don't always have the best interest of patients at heart. There are loads of other examples. Can you think of any?
Well, the one that immediately comes to mind is the opioid crisis. I mean, the opioid crisis has been caused by over-prescribing of medication. And, you know, at the beginning, I remember the spin. I remember they were saying, you know, if you have a long-term pain condition, then yeah, we'll just prescribe you OxyContin and it's no problem. And now you have people who are heroin addicts for life. Because of this. So it's so completely obvious, but all of this has been written. This has been written out already. In 1979, the book came out, The Transsexual Empire, where a woman spoke very clearly about what the future looks like when we affirm this so-called feminine essence theory, which is what men like Richard Levine believe. They believe that they have a feminine essence, feminine soul, and because of that, we have to all capitulate as women and affirm him as a woman, as a lesbian, and all of his other crazy fantasies, okay? And at the same time, the medical community has to step in. And I just want to say that there is doctors out there who actually will perform some of the craziest surgeries I've ever heard of in my life. A very famous doctor who's actually the one that kind of coined the term autogynophilia. He described to me that he had a patient that would come in and would ask for a kangaroo pouch to be created, and he drew up these very elaborate designs for the structure.
Wait, so Alex, I just want to clarify. So the person who wanted the surgery was drawing up the designs for it. So this was a doctor. This was a doctor who was.
Essentially, yeah, and you know what these men, it kind of shows you the way that the fetish will overtake your life. Okay, so this was a man married. This is a man married to a woman, a doctor married to a woman, and he, you know, basically traveled around the United States with her to kind of and would show these doctors this design, this thing, and would say, please do it to me. Now, this was 10 years ago when this type of stuff, they would not do this crazy surgeries, right? They would do the vaginoplasties and all of those other, you know, barbaric practices. But they weren't doing this kind of, we'll drill a hole in you and you can have a kangaroo pouch and whatever.
Now, Alex,
you know,
to be clear, the kangaroo pouch is for people who want to keep their male genitals, but also have a hole, an extra hole down there.
Yeah, and what are the motivations? The motivations are the usual: having your cake and eating it. Okay, these autogynophilic gender dysphoric males are so obsessed, and they have these kind of incompatible impulses, right? And the most common resolution is the aspiration to become a lesbian, which amalgamates in this desire to have a woman and be a woman. So it's just so completely creepy and crazy. And, you know, my instinct is not to judge a guy with a fetish or a paraphilia, but at the same time, I don't want to take medical advice from him. I really don't.
And women who are concerned about it are being attacked and often bullied and told that they're hateful and bigoted and should be beat up and choked and spit on and all sorts of horrible things if they don't accept these male fetishes as actual women. And that's where it becomes concerning, is that this is no longer something that's staying in the privacy of their bedrooms. This is now bleeding into the public sphere, and it's impacting those of us who are actually biological women, who are now being vilified for standing up for our rights as women.
Yeah. And it's so completely nuts because, you know, transsexual is something that you do, right? You're performing this act in society, and people are either humoring you and going along with it and playing pretend with you, or they're not. I'm not playing pretend. I'm not gonna do it. Lock me up. So, you know, I'm never going to call him she, never going to call his thing a lady stick or a she-ness or whatever else. I can't even say it. It's so disgusting. I'm not going to do it, and you'll have to lock me up.
And that's what's scary, is that I feel like the chances that they might start locking us up. At the very least, I know that you know, our right to speak truth is being now impinged on, and we recently had yet another proclamation from the president about the rights of these paraphiliacs who are demanding protections that are actually infringing upon the protections of women. And so again, this is no longer just about, you know, tolerating somebody's sexual fetish. It's about these fetishes now really bullying women. It's about our basic rights now being denied, and us even being denied the opportunity to stand up for our rights in some cases.
Well, they really have a sense of entitlement. I mean, they think that they're entitled to whatever they want. You know, if I want it and you tell me no, then you're invalidating me, and that is a hateful thing to do. Well, no, it isn't. You're not entitled to everything.
Yeah, it's so interesting, Alex. You posted a video this week, and it had, you know, this man who was wearing a dress and some lipstick, and he was just wailing about TERFs, you fucking TERFs, and he was singing out, and you could tell he felt so valid, and the hatred was just oozing from him. I mean, it was clear this is a man who hates biological women because he isn't one, and he wants to be one. And it's very, you know, at first I thought it was kind of funny because I was watching it. I was shocked at how much hate there was, and how much, you know, I think the fact that these are men who are advocating oftentimes for violence against women who disagree with them. It's really concerning that we have top officials in our government who are advocating for their rights and suggesting that anybody who doesn't, you know, affirm them in their paraphilia are actually somehow hateful. That's really setting us back in a way that is hard to even imagine.
And how much was Rand Paul actually monstered for his reasonable interrogation of Levine's position on puberty blockers? Okay, and I'm not particularly a Rand Paul fan. You know, I mean, he's not on my radar, but I was just thinking, you know, he's asking really plain, simple things. Now, I really wonder what would have happened if instead of Rand Paul, they would have had a really gutsy woman who was going to say, listen, Richard, tell me about your transition. Tell me about your insatiable need for your insatiable heterosexual male belief that you're a woman. You know, because actually those are the questions that we need to be asking, because that is the crux of the issue. The issue is not that he's live action role playing. It's this insatiable narcissistic desire to be at the top and to be making the decisions for women. Okay, this is really concerning. Okay, it's just mind-boggling to say. It's almost like if I was to say, okay, I'm going to become, not only am I going to join an organization for Black people, I'm going to be the CEO and I'm going to make all the decisions for the Black people. It's
we've seen
And if
this.
anybody challenges you, they're racist and Nazis and should be sent to jail.
Yeah, but we've
Yeah.
seen this. We saw Rachel Dolezal claiming to be a Black woman, and she became the president of a chapter of the NAACP, and she was excoriated when she was found out, when it found out that she wasn't Black. And they were so furious about that. I'm like, what's the difference?
Yeah,
What's the difference? There is more biological difference between a man and a woman than between a white person and a Black person. Far more.
And in fact, it can be empirically, sex can be empirically tested, whereas race is, as you said, much more subjective. I mean, we can see chromosomally whether somebody is male or female. This is something very clear.
Race
Not to mention
what your melanin, what kind of melanin you've got in your skin. That's it.
Yeah, exactly. And so again, I think it's pretty ridiculous. And so I'd encourage people watching this to go to Partners for Ethical Care if you're concerned about this. Come to our website. You know, this is in my mind, what's happening now is no different from when they were sterilizing women, Indigenous women, no difference from when they went, colonials went in and sterilized women in third world countries. This is eugenics at its worst. We are sterilizing children. This is so, we know that doctors make mistakes, and we need to really push back before it's too late, because we joke about going to jail, but we have Rob Hoogland, who's in jail now in Canada for speaking out about this. Jeff Younger in Texas has been threatened with going to jail. And so it's not unreasonable to think that they might start rounding us up and putting us in jail if we don't stand up and stop it.
And parents are having their own biological children taken away from them if they don't agree to give them puberty blockers and wrong sex hormones. That is happening. I have made peace with the fact that I may end up in jail for my stance on this. Yeah. Because I think it is that important.
Yeah. And I would just also like to say, I was previously concerned that, the people that children would be playing with, if their parents would be gun owners, that used to really concern me in general. And now I don't care. I want to know if they believe other kids can be born in the wrong body. Okay, that's what I want, because that is so much. I mean, I understand guns are dangerous, but I want to know if they believe this crazy nonsense that it's possible that, little kids can be born in the wrong body. I want to know that. I actually just want to know. As much as I'd want to know if you have firearms at home, because it's so poisonous.
Access drugs easily. I mean, to me, this is like a fundamental thing, that if you believe that somebody can be born in the wrong body, it gives such an indication into your whole mental outlook. And the thing that's astonishing to me is how many people who say they're atheist insist that it's possible to be born in the wrong body, which seems to me
religion. This is a religion. Because there's no empirical evidence for any of it. It's fully a belief, and they'll say that. It's what you feel inside. Maybe that's a religion. That's a religion.
Yeah. It's a religious belief, and it's now being imposed on people in a way that is really disheartening. And again, I just want to go through, lobotomies is something that doctors used to do. They used to think that it was a great idea to give people lobotomies. I think, Maria, you mentioned in another show that we did on a Common Sense Care episode that the man who came up with the lobotomy actually got a Nobel Prize. Doctors get it wrong sometimes, and that's why we have to keep an eye on it, because
women used to
get it wrong.
Women used to be institutionalized for, and I forget what it was called, but it was like mania or
hysteria, probably
hysteria. They would be institutionalized.
Hysteria.
And what was hysteria? It was a man not liking the way the woman was behaving.
Right.
I mean,
An
that's what
uppity
it was.
woman, an uppity woman.
Mhm.
Yeah, so we need to stand up for our kids again.
Yeah.
It's horrifying to me when, when I think about the combination of puberty blockers and then growth hormones and then cross-sex hormones. Oh, any one of those is horrifying, but the combination of all three, those poor little bodies, I just can't even imagine what the long-term result's going to look like.
Yeah. And also, I just would like to say, I've not encountered in my time a religion as bigoted as this. This is right up there with shooting you if you're not a believer. So if you're
They
concerned, if you're,
advocate raping people who don't agree
yeah,
with them.
yeah, they're crazy.
Yeah.
And I think if you're a parent or if you're a woman or if you're just a general person, a nurse, a doctor, anybody's concerned, come to Partners for Ethical Care. We want to hear from you. We have video after video after video about this common sense care. If you're a parent and your child has recently told you that they think that they're born in the wrong body, come and visit us, speak your story. You're not alone. I know it must feel terrifying, but you're not alone. And help is out there, and we want to be at the forefront of that movement of alleviating this.
All roads do not lead to the gender clinic.
No.
Come
Yeah.
visit Partners for Ethical Care and find a different and better path.
Yeah.